Want to become a smart mom is easy. Respiratory tract infections are the most common disease of children. Nowadays, one child suffers from allergic rhinitis out of 2 children in Hong Kong. Allergic rhinitis children have 3 times higher risk of getting asthma than normal children. In general, more than 70% children with asthma also suffer from allergic rhinitis, and it is not cured. Respiratory infection illness does not only include allergic rhinitis and asthma, but also general colds and coughs, runny nose, sneezing, nasal congestion, tonsillitis, acute otitis media, bronchitis, pneumonia, and so on. Nearly 90% of pediatric patients have allergic rhinitis symptoms every month. Those children may have fever, loss of appetite, and affect sleeping quality, which cause them cannot concentrate. It will directly affect their social life and learning ability. Therefore, the long-term impact on respiratory infected children is a problem that cannot be ignored in their life. The drug only treats the symptoms, but not the illness from the beginning. Also, the long-term use of drug becomes a physical and mental burden to our children. How do we prevent respiratory infections? We believe Babybelle 3-in-1 Elephant and Dolphin can help us. Babybelle 3-in-1 air compressor nebulizer system can extend respiratory care from medical institutes to home that directly reduce the incidence of disease. At the same time, this incredible nebulizer can reduce the mental stress of parents and saving medical expenses for the family. For infant nasal cleaning, pat the baby's back and then massage next to the nasal cavity. Connect one end of the air tubing to the machine's air spray hole. Remember that suck and spray function has its own exclusive jack. Do not mix up and do not plug into the wrong jack. Open nebulizer cap, pour saline solution into the cap and then spin it to close. Connect another end of the air tubing with nasal spray bottle set. Put the spray head near the nasal cavity, head slightly tilt forward. Then turn on the power. Use the index finger to press the spray bottle's control valve. You can start to clean nasal secretions. Connect one end of the air tubing to the machine's air suck hole. Remember, the suck and spray function has its own exclusive jack. Do not mix up and do not plug into the wrong jack. Connect another end of the air tubing to the suction bottle set. Put the mucus suction head of suction bottle set into nose. Make sure the mucus suction head and nostril are closely fitted for better results. Turn on the power. Use the index finger to adjust the pressure control valve. It can start to draw the nasal secretion. Connect one end of the air tubing to the machine's air spray hole. Remember that suck and spray function has its own exclusive jack. Do not mix up and do not plug into the wrong jack. Put the triangular cone into the spray drug cup. In order to maximize the atomization mix effect, the cone must be placed properly. Pour the doctor's prescription or saline solution into spray drug cup and spin to close it. Connect another end of the air tubing to the spray drug cup set's connection. For older children, they can use the L-shaped mouthpiece directly. For infants, they can use the mask piece. Connect the mouthpiece or mask piece with the upper end of spray drug cup. Turn on the power, and then you can start to follow the doctor's instructions for aerosol therapy. Attention! It's only suitable to use doctor-recommended medicine, doctor prescription, or a saline solution. Do not use water or tea for any treatment. Simply turn off the power after use. All other parts can be set apart for washing with detergent, rinse with water, and dry in the air, except for the main body and tubes. The accessories, except tubes, can be soaked in hot water, disinfectant, or use a sterilizer machine to disinfect after washing. Do not boil to disinfect directly. Use a damp cloth to clean the main body. For a detailed cleaning method, please read instruction manual. Do not disassemble the machine directly. Take care of children respiration. No need to consult doctor.